Good morning. I'd like to call this meeting of the House Insurance Committee to order. Alia, please take the roll.
Chair Warren,
I'm here.
Abney,
Designation.
Brennan, Cephas,
Designation.
Haddock,
Designation.
Kozarowski,
Designation.
Malagari, Mirsky,
Designation.
Mullins,
Designation.
Monroe,
Designation.
Parker,
Designation.
Sappy,
Designation.
Scott,
Designation.
Venkat.
Here.
And Representatives Mullins and Abney have joined us.
All right. Chair Pickett,
Here.
Bernstein,
Designation.
Flood,
Designation.
Fritz,
Designation.
Griner,
Here.
Kutz,
Designation.
Ledbetter,
Designation.
Nelson,
Designation.
Olsummer, Schmidt, Watrow, Zimmerman. We have a quorum.
Thank you, Alia, and Representative Mirsky has joined us as well. As our first order of business, I will call up House Bill 1828. Joe, please explain the bill.
House Bill 1828 requires health insurance policies to continue covering vaccines that the federal government required insurers to cover without cost sharing as of January 1, 2025. Additionally, the insurance department may exempt vaccines or require coverage of additional vaccines following a determination by the Department of Health. The bill includes a religious exemption.
Thank you, Joe. And I offer as an amendment to the bill, Amendment A01731. If you could, please explain the amendment.
Amendment A01731 makes technical changes to the bill.
The question is, will the committee agree to the amendment? Is there any discussion on the amendment?
No comments, Mr. Chairman. Thank you.
Thank you, Chairman. Are there any negative votes on the amendment?
All Republicans will be a no.
Okay, with all and all Democrats will be a yes. With all Republicans voting in the negative, the amendment is adopted by a 14 to 12 vote. Do we need to take? Okay. Okay. On the bill, the question is, will the committee report the bill as amended? Any comments, Madam Chair?
No comments. Thank you, Mr. Chairman.
Thank you. Is there any further discussion of the bill? Representative Venkat.
Thank you, Chair Warren, and thank you to the members of the committee for bringing up House Bill 1828. For millions of Pennsylvanians who choose to receive vaccines, they have come to depend upon insurance coverage without cost sharing as part of their choice to receive a vital preventive health care measure. And House Bill 1828 is absolutely necessary to meet that expectation. I'm extraordinarily grateful to the governor and his administration for the work they have done related to coverage of vaccines. And I think it has been extraordinary what they've done. But simply put, at this moment and after the 2026 plan year, we will be completely at the judgment or altruism of insurance companies when it comes to whether that continuation of coverage without patient responsibility will be in place for Pennsylvanians. Fundamentally, this is a conservative bill. It protects personal choice, it recognizes the cost effectiveness of vaccines, and it brings public health decision-making back to a more local level. I want to thank my co-prime sponsors, Representatives Khan and Kozarowski. I also want to thank Chair Warren and the Insurance Committee staff for their hard work on this legislation and the input of the administration. I can think of no greater responsibility that we have as legislators than to protect the public health of our fellow Pennsylvanians, and I ask for an affirmative vote.
Thank you, Representative Venkat. Is there any further discussion on the bill? There being none, are there any negative votes on the bill?
Thank you, Mr. Chairman. All Republicans will be voting no.
Thank you. All designees and I, among the Democrats, vote yes. Are there any negative Democratic votes? There being none, all Democrats vote in the affirmative, and the bill is reported as amended by a 14 to 12 vote. Next up, I call up House Bill 1123 as our next order of business. Joe, please explain the bill.
House Bill 1123 updates the insurance company law by lowering the age for colorectal cancer screenings from age 50 to age 45. The bill also updates statutory references to cite the most recent American Cancer Society guidance on colorectal cancer screenings.
The maker of the bill, Representative Gallagher, is here, as well as our Appropriations Chairman, Chairman Harris. Chairman, would you like to say a few words?
Good morning, Chairman Warren and Chairman Pickett and the members of the committee. I thank you so much for this opportunity. Earlier this year, I introduced House Bill 1123 alongside my colleagues, Representative Gallagher and Khan. This bill updates Pennsylvania's insurance law to require coverage for routine colorectal cancer screening beginning at the age of 45 instead of 50. This change aligns with state law. This change will align our state law with the federal guidance and the recommendations of the American Cancer Society. But more importantly, it reflects what the data and too many family experiences already tell us, that screening and early screening saves lives. This year alone, more than 6,500 Pennsylvanians will be diagnosed with colorectal cancer. It remains one of the most preventable yet deadly cancers in our country. According to the American Cancer Society, when colorectal cancer is caught early, before it spreads, the survival rate exceeds 90%. But when diagnosed later, that number drops dramatically. We also know that this disease is changing. Over the last decade, colorectal cancer diagnoses among adults under the age of 50 have increased by 50%. Access to preventative care should not depend on your zip code, income, or background, yet we continue to see deep disparities, particularly in communities of color, rural areas, and among low-income Pennsylvania, where screening rates are lower and outcomes are worse. Black and brown communities are disproportionately impacted. Black Americans are about 20% more likely to be diagnosed with colorectal cancer and 40% more likely to die from it. That's not because of their biology, but it is because of barriers to preventative care. By ensuring that insurance coverage begins at 45, we can help close those gaps and make sure that more Pennsylvanians have the opportunity to detect this disease early when it is most treatable and can be survived. Beyond the human cost, early detection also reduces the economic strain on families, insurers, and quite honestly, the entire Commonwealth. I bring this legislation forward because I know what is at stake. Last year, I lost my wife, Tiffany, to colorectal cancer. Her loss remains one of the most profound moments of my life. Tiffany was 36 when she passed. She died way too young. Many of you here remember Tiffany. Remember her smile, her laughter, her sense of fashion and style. She was a vibrant, beautiful woman. On May 19th of 2023, she was diagnosed with stage 4 colon cancer. May 19th is a day that will be etched in my mind forever. We went to the emergency room thinking maybe it was a ruptured appendix or something because she had been throwing up. She had literally no symptoms beforehand. Yet this young, beautiful, vibrant woman who was healthy by all other accounts will begin a battle that she fought courageously for 16 months, fighting colorectal cancer that had metastasized to her liver. On September 7th of last year, we lost Tiffany. Now, some would say she lost her battle with cancer. But as a Christian, I believe that she didn't lose her battle, but she just won her healing on the other side. And I sit here today still deeply heartbroken from that loss. But the battle continues with legislation like this that can ensure that no other family has to go through the same thing. Had Tiffany had a colonoscopy early on, had it been caught, chances are she would be with us today. And so I ask for your support of this legislation, understanding that early detection is the most effective way to save lives, so no other family has to bury their child, nor else the husband has to bury his wife far too soon before their time. And so I thank the committee for their full consideration.
Thank you, Chairman. I'm very sorry for the loss of Tiffany, and I thank you for your testimony before the committee. With respect to moving the bill forward, for the information of the members, when today's meeting was originally scheduled, we intended to offer Amendment A01746. We later revised the amendment to exempt hospital indemnity plans, and therefore A01746 was withdrawn, and I offer A10790. And before, Joe, you explain the amendment, we've also been joined. There are a lot of committee meetings today, and members are members of as many as 6 committees, and so folks are coming in and out. But we've been joined as well by Representatives Nelson, Ledbetter, Kosierowski, and Scott. Joe, would you please explain Amendment A01790?
In line with federal standards, Amendment A01790 requires coverage of CT colonography, multi-target stool DNA tests, and follow-up colonoscopies if there's a positive stool-based or direct visual test. The amendment also updates references to guidance for high-risk individuals, addresses cost sharing, adds standard boilerplate insurance language, and exempts hospital indemnity plans.
Thank you, Joe. And the question is, will the committee agree to the amendment? Chair Pickett, any discussion of the amendment?
No comment on the amendment, sir.
Thank you. Any further discussion on the amendment? Are there any negative votes on the amendment? Thank you. Hearing none, Amendment A01790 is adopted unanimously. On the bill, the question is, will the committee report the bill as amended? Madam Chair?
Thank you, Mr. Chairman. I do want to offer just a couple of comments, and I want to thank you, Chairman Harris, for appearing here before this committee today. There certainly is no lack of compassion for those affected by cancer. It literally touches everyone. You and your family are in our thoughts. Given the effectiveness of colon cancer screenings and tests, it's very important that state law keeps pace with national standards. The committee recently passed a bill that updates state law for breast cancer screenings and tests. Therefore, I am supportive of House Bill 1123, and I do ask for an affirmative vote.
Thank you, Chair Pickett. Is there any further discussion on the bill? Seeing none? Yes. Representative Ledbetter.
Thank you, Chairman, and thank you, Chairman Harris, for your courage and bringing this before us today. As someone whose father is battling cancer at a younger age than projected, and as a Filipino American, I too share in the concern and disparity between Black and brown communities and the reflection within policies that are presented that need updated. It's my hope that we can collectively within this committee vote in an affirmative manner to advance this piece of legislation. And again, I thank you for your courage in communicating your story and advocating an important piece of legislation. Thank you.
Thank you, Representative. Is there any further discussion on the bill? Okay. Are there any negative votes on the bill?
All Republicans will be yes, sir.
And I believe all Democrats vote in the affirmative, and consequently, the bill is reported as amended by a unanimous vote. Congratulations, Representative Gallagher. Thank you, Chairman Harris. Done. There being no further business before the committee, the meeting is adjourned. Thank you.